and welcome back to your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Thanks for joining me today. I'm going to be covering the basics of PANS today. PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. This is very similar in a lot of ways to my previous video's topic, which was PANDAS, but it's different in one very important way. With PANS, we don't always know what the autoimmunity, this acute onset of symptoms, is caused by. And with PANDAS, we know that it's caused by strep. It has a lot of the same symptoms, a lot of the same treatments. And so I'm going to quickly go over those. If you're curious, please watch the previous video as well, where I mention some different things about PANS that also apply to PANDAS. Now, again, as with PANDAS, PANS is acute in onset, meaning the symptoms come on rapidly, seemingly overnight. This is not something that has built up over time and is getting worse and worse and worse. This is something that literally one day they're fine and one day they are not fine. And there's a very clear day that it started. You can say they were fine and then this happened and they were not fine. So typically you want to kind of pinpoint when that was, because if you can do that, then it's easier to pinpoint root causes and figure out, where do you start with testing? Where do you start with treatment? So of course you want to rule out strep infection if PANS is kind of a diagnosis that your provider that you are thinking of, because if it is strep, then it's PANDAS and not PANS. And so that's going to change what treatment the child needs. And once again, with the symptoms, typically OCD type symptoms, anxiety, tics, tremors, sleep problems, urination problems, regressions in things like behaviors, regressions in sleep, regressions in handwriting, regressions in things like memory or memory lapses. There's a lot of different physical and psychological symptoms that are associated with PANS and PANDAS. Now, if you're looking for a full list, I've kind of made up a list, and I talk about this extensively in the PANDAS video as well, so be sure to watch that. As with PANDAS, there's no definitive test to diagnose PANS. Some tests, like I mentioned, that would be expected would be things like a throat culture to check for strep. Sometimes we can do ASO or anti-streptolysin O antibodies, again, to check for the immune system's reaction to strep. Sometimes we can do DNase antibodies as well, again, to kind of check for the immune system's reaction to different things. We can also do EEGs, so brainwave studies. We can do sleep studies and different things to kind of especially rule out other causes of this kind of brain on fire situation or inflammation, encephalitis kind of situation that's associated with PANS and also PANDAS. Once again, if your child has something serious like PANS or PANDAS, this is a situation where it's really not going to serve you well to try and have a DIY approach. You're really going to want the help of a provider, a professional who deals with this kind of thing and who treats this kind of thing regularly. A few different approaches to treatment typically are going to be, it's going to be a three-pronged treatment approach. One is go after the infection, treat the infection that seems to have caused the start of the symptoms. And the second thing is to manage the inflammation and the autoimmunity. Sometimes that's done with steroids or NSAIDs, so non-steroidal anti-inflammatory drugs like Advil, ibuprofen. Remember, don't give your kids aspirin. It's also an NSAID, but not appropriate to give children aspirin. Tylenol is not an NSAID. Acetaminophen, not an NSAID, so does not battle inflammation like ibuprofen or Advil, Motrin would. And then the third type is managing the symptoms. So the third kind of approach to treatment is managing the symptoms of things like tics, anxiety, mood disorders, sleeping disorders. So we often see things like SSRIs, which for example would be like Prozac, Paxil, Celexa, that sort of thing. sometimes if sleep is one of the big issues that we're experiencing with our kiddos with pandas, we need to figure out how to get them to sleep so that they can be healthy and so that we can also get our sleep and be healthy and ready for our days with our kids. So sometimes it's okay to use things like melatonin, magnesium, 5-HTP, different things like that, that may be more on the natural side of things. Maybe you're more comfortable with that type of thing. And sleep is so important. So it's really important to address sleep if that is an issue, because that's going to help the child's body fight whatever is going on and hopefully recover much more quickly. Thanks for joining me. Remember, be gentle with yourself. You're doing a great job.